So for this afternoon, we're going to continue with the protozoa. Okay, ayan, sige. So, and our discussion will center or will focus on the miscellaneous na mga protozoa. So, kung siya mga pakapin, no? Charot. So, naka-feel na mo na pakapin na mo, check ka. Okay, ganun level. Alright, sige. So, this is, again, your miscellaneous protozoa. Sige. So, madunggan ako, dears. Can you hear me? Okay lang? Bisan ka na na-question, wala mo ito ba? Madunggan ako, dears. Okay. Wala na siya labot sa points. Madunggan ako, okay ra?
Yes, sir.
Okay, alright, sige. So, muna siya akong setup karon kay mag-live selling ta, no? So, nako'y whiteboard. For sale, 54321, charot lang. But also, the whiteboard. So, magsulat ako here, and then I hope maklaro lang siya. So, I advise na ipin na lang ko sa center, char, or ang presentation ba yung ipin, basta maklaro lang niya siya. Okay? Para if na ko yung mga ipang chika diri, or ipang right. Okay? So, ayaw ipin yung mga crush dira, nako Marilyn, nako talaga, sinasabi ko talaga. Mga don't fall in love with their blockmates. Ako, na-joke ko yung mga, nako. So, ayaw ipin na sa center ha inyong crush. Ako nala ipin. Okay? Para at least naman makafeel ko na at least murag i-prioritize ko at this time. Charot, drama. Okay. Ayan, sige. So, again ha, so nako'y pang write sa whiteboard. So, hopefully makita rin ninyo. Okay, sige. So again, these are your miscellaneous protozoa. So when you say miscellaneous, again, mga additionals lang, no? Not necessarily additional na muragwa sila pulos. They can also cause infections gapon to your humans, to us, no? And especially what we're looking after are, or asa siya important, is the fact that these protozoa, most of these miscellaneous protozoa, they cause great disease, no? Or they wreak havoc, intense ilahang mga symptoms na ginakos, and the disease that they cause to the immunocompromised. No? So these protozoa usually are very important, very significant, especially with patients who are immunocompromised. Okay, so most of them. Okay, ayan, sige. Now, we're going to look into this again. Ato ang flowchart no, sa atong discussion. So, protozoans pa rin tayo, okay? But for this miscellaneous protozoa na discussion, it's more of a mix, a variety niya of different protozoans. Na amoeba, na mga sporozoans. So, muna siya itong i-focus karon. Again, very important because these protozoa usually affect greatly the immunocompromised patient, especially those with AIDS. Okay? All right, ayan, sige. All right, so we'll start first again with your intestinal coccidians. Ayan, mga coccidians. Ah, yes, okay, so mga coccidians. Now, your coccidians is part of a large phylum, no? And this phylum is known as the Apicomplexa. Now, aside from coccidians in the Apicomplexa na phylum, ang naa dito is of course your malaria parasites, and babesia. So supposed to be kaning malaria, babesia, and toxoplasma. Muna siya itong discussion this week, but because of mga sudden changes in the environment, sudden changes in schedule and mga personal eme. So wala ko naka-prepare or like di pa ko ready to discuss this. Okay. So next week na lang siya. Okay? So we're focusing or we'll discuss na lang the miscellaneous kato mga additional na mga protozoa. Okay? But they're all under one big phylum, and that is your Apicomplexa. Now, by the name itself, Apicomplexa, it's named Apicomplexa because it contains an apical complex. And this apical complex is a group, no, para siyang a complex, a group of structures in the organism's body that facilitate in infecting the host, or that facilitate in helping the organism infect the host. So example, mga rhoptries, no, polar rings, and micronemes. Now, this complex, apical complex, is found in all organisms under this phylum, which is your Apicomplexa. So your malaria, naa siya ani, your coccidians, na po, your babesia, naa. Now, there is no apparent, please take note, no apparent means of locomotion, or wala sila apparent locomotory organelles, but it's still being studied din naman. Pero for now, ang established kay wala siya motion, wala siya organs for locomotion. Unlike your amoeba, di ba, na pseudopods, no? Your flagellates that have flagella, and of course, the ciliate that contains cilia as their organs of locomotion. For apicomplexans, wala pa established na organ for locomotion, or wala sila established locomotory organelle. Okay? Unlike the rest of the groups, no, natong na-mentioned in the previous lectures nato. Okay, all right. Now, again, they are unicellular, protozoa pa rin. They live intracellularly, so they need cells, no? They need live cells for them to infect, or their life cycle happens within cells, okay, intracellularly. All right, ayan. Now, all coccidian, okay, all coccidian, they have a different phase. No, they have the sexual and asexual stage. So when you say sexual, it's known as the sporogony or sporogonic phase. Your asexual is also known as your merogony or schizogony. Sige, ako rin na siya ipang right sa atong live selling diri. Okay, sporogony, and then you have merogony or schizogony. Okay, all right. And of course, the last stage is your gametogony. So by the name itself, gametogony produces your gametocytes. Ayan. Okay, sige. Taka lang, nagsusulat pa ako. Okay, so sexual and asexual. So again, sexual, ayan. Wala ko ga-quiz ball, no? Ayan. So sporogony, sexual, merogony or schizogony is asexual, and gametogony produces gametocytes. Okay. Now, merogony or schizogony. Okay. So this is the life cycle that's followed by your apicomplexans. Will encounter these terms ulit when we go to malaria and babesia and also toxoplasma. So it's part of their life cycle. Okay. All right. Now for the coccidians, ang ma-produce sa sporogony is your oocysts. Okay. Now for schizogony or merogony, ang ilang ma-form is your merozoites. Nasa pangalan na, merozoites, okay? And for gametogony, ang ma-produce nila is gametocytes. Now, your gametocytes, pwede siyang macro, big, or micro, okay? Now, these two gametocytes, they have their own gender, in a way, gender. All right. Now, the macro is the female, ayan, and the micro is the male. Ayan. So, dito, very good kasi woman empowerment tayo. So, malaki si macro, female, and maliit si micro gametocyte. Okay? So, in a way mo na gender sa duwa nimo ka gametocytes, no? So, they produce two gametocytes, micro and macro. So, macro gametocyte is female, okay? And micro gametocyte ang male. All right? Ayan. So, woman empowerment, yes. Okay. All right. Sige. So, those are the different phases sa life cycle sa imuhang sporozoa or your apicomplexans. Okay? All right. Ayan. Sige. So, that's for your intestinal coccidians na na introduction. Yeah. So, mura ko live selling, di ba? Okay. All right. Now, we go now to, again, the diseases. No? Generally, these coccidians or, these organisms are opportunistic. No? So, they are opportunists and they can cause great havoc or can cause intense symptoms and diseases among the immunocompromised. So, if you are normal functioning, you have a normal functioning immune system, then in a way, your symptoms are self-limiting or self-limited, and they will not progress to a severe form. Unlike if you are immunocompromised already, especially in patients with AIDS, no, then your symptoms can be severe and even life-threatening. Okay, but generally they are they are opportunistic. No, so opportunistic lang. So makakause of disease if ever the patient is already weak or ilahang immune system kay dili na mo function well. Diba? So mga opportunist good, like kanang mga tao na mo take advantage nimo kay abig weak ra ka, charot. Ganung level, okay? Ano mga, nako, charot. Ang sarap charot lang. Anyway, ayan, so, ayan, opportunistic sila, okay? Immunocompromised and immunodeficient individuals. Now, again, schizogony, diba, or merogony, the asexual part, it happens in a variety of nucleated cells because, again, they are intracellular. And the sporogony happens in the intestines, usually, of the definitive host, of course. And again, as mentioned, ang ma-produce sa sporogony is the oocysts, all right? So, oocysts, therefore, is the infective stage sa ato ang mga coccidians. Okay? So, di ba? If nakikachika na mong beshi, tapos mo agree ka, unsa man mo ingon? Oocysts. Please type og ha 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 ha. Salamat sa pag-support sa akong joke. Thank you kaayo. Naway pagpalain kayo ni Lord. Okay. So infective stage nato for coccidians is oocyst. So if magchika ang duha ka coccidians, if mo agree sa each other sa ilahang itubag, oocyst. Ayan. Amen. Atong salmo responsorio, oocyst. Okay. So please take note. Infective stage is your oocysts, okay? And the oocysts are produced from sporogony, the sexual, okay? So how do I remember? Sporogony, nasa pangalan na parang it produces spores, di ba? And usually spores are produced sexually. So ayan, sporogony. That's how I remember lang, no? Para easy. So sporogony, schizogony. Or kung sporogony, sexual, so di ba, open kayo mong mouth. So, alam nyo na. Ayan, so, sporogony. And like sa schizogony, di ba, close ang imuhang mouth. So, asexual. Bakit mouth? Oh my God. Charot. Ano lang, mga kalat na mga mnemonics. So you can use your own mnemonics just to remember, okay? But that's how I remember. Sporogony, so open ang mouth. So very Charot. Okay, ayan. So, ganun. Okay, so infective stage na to is still, again, your oocysts. Okay. All right. Now, we go now to the first coccidian parasite, and that is your Isospora, belli. All right. Iyahang new name karon, which is, again, well accepted na pod, is Cystoisospora. Pero if ginagamit ka pa ng Isospora, so Isospora or Cystoisospora belli. Now, this parasite, according to Zybig, okay, it's the only parasite that doesn't, coccidial parasite that serves or that does not have an intermediate host. Pero if you can see, if you look into other references, na ubang mga parasites or coccidial parasites na ay intermediate host, di ba? So, parang, I don't know kung sa pasabot ni Zybig ani, no? Pero ako na siyang gi-include, kaya baka naman lumabas sa boards, no? Pero ang point lang siguro is, based other references po, they mentioned that Isospora belli, among the coccidian parasites, is the only one, or like, siya ang important yun na remember ninyo is, sa Isospora belli, man kita serves as the only host. Okay? So, kita ra gyud ang host sa imong Isospora belli. Unlike sa mga ubang coccidian parasites na pwedeng na animals, no, or mga plants pod, for Isospora belli, it's only humans gyud. Okay? Alright, so, please take note of that. Now, definitive host, as I mentioned, is kita, man. Okay? So, this, unsa man na phase ang mahitabo nato ani kay definitive host man. Unsa man na phase sa iyang life cycle? Your
Sexual reproduction.
Sexual.
yeah, sexual reproduction. Yeah. Unsa may term ato your
Sporogony.
okay, your unsa man to? Sporogony, di ba? Don't forget sporogony, di ba? Nag-produce og spores, meaning sexual reproduction. Also sporogony katong kamo na bahala. Okay, ayan. So sexual reproduction, of course, sporogony, di ba? But kini siya ng mga terms here sa sporogony, schizogony, it's only found in the apicomplexans. Pero atong mga nematodes, mga flagellates, wala yun, ana. Okay? Alright, ayan. Sige. So definitive host kita, man. Okay? Next, infective stage is, of course, the sporulated oocyst, or when you say sporulated, mature or infective na oocyst. Okay? Alright. Now, mode of transmission, again, same with your amoebae and flagellates, it's ingestion of infective food, of the infective oocysts through food and or water. Okay? All right. Ayan. Sige. So that's for the mode of transmission for Isospora or Cystoisospora belli. Now, for the life cycle, as you can see, so di ba, oocyst man ang infective stage. So once the host ingests the oocyst insists or mutapot siya sa small intestine, okay? And inside the oocyst is the sporozoites. Now, the sporozoites are released from the oocyst, and these sporozoites will then infect other epithelial cells in the intestine to produce schizonts, okay? Which is, again, schizogony na process, which is your asexual. Now, inside the schizonts are the merozoites. Ayan. Now, the merozoites, after they are released, no, they will then infect other cells or pwede silang mahimong gametocytes. Ayan. Sige, ako na lang siyang i-draw para mas masabtan. So you have oocyst atong infective stage, and of course, ang sulod sa oocyst is the sporozoites. Okay? And then sporozoites infect other cells to form schizonts. Okay? And then the schizonts, ang sulod niya kay mga merozoites. Now, the merozoites can either infect new cells para makaproduce siya more merozoites, okay? Or pwede siyang mahimong gametocytes. Sige, ako lang gidro para... Okay, sorry, gamay mo ako ang board, no? So, ayan. So, we'll start first with the oocysts. Sorry, maglibo ko sa direction. Oocysts, no? So, makaon siya sa patient, okay? So, pag makaon sa patient, of course, diba, mutapot niya siya sa small intestine. Now, once mutapot siya sa small intestine, mo rupture to release the sporozoites. So, inside the oocysts are the sporozoites. Now, the sporozoites will then infect other new epithelial cells sa intestines to form schizonts. Okay? Now, schizonts, ang sulit sa schizonts kay merozoites. Okay? So, kanina part sa schizonts, merozoites, muni siya ang asexual reproduction, schizogony. Okay? Now, asan ako? Now, the merozoites na release, it could infect new cells, new epithelial cells to produce more merozoites, or pwede siyang mahimong gametocytes. Okay? The micro and macro gametocytes. Now, diri na part kaning pag-produce o gametocytes, no, gametogony. Now, the gametocytes, once mo produce siya o gametocytes, diba, the micro and macro, they could combine together, no? The micro and macro gametocyte, they can combine together to form a zygote. And this process now is the sporogony na part. Okay? So, ang duha ka gametocytes na micro and macro, they could fuse together to form a zygote or fertilized na structure. Okay? Now, the zygote can mature then into an oocyst. Okay? And that is now the life cycle. Muna siya infective stage sa imuhang, imuhang Isospora belli, di ba? And coccidian parasites din naman. Now, please take note, di ba, na pagpagawas sa oocyst sa imuhang patient, sa Isospora belli, the oocysts are not yet mature. Pagpagawas sa stool, pagkalibang niya, the oocysts found there are not yet mature. So, mo take pag mga about 2 days before siya mahimong mature and before siya maka-infect og lain na host. Okay? Nagets ra? So, di ba, again, oocysts, makaon sa patient. Okay? And then, inside the oocysts are the sporozoites. Okay? Tapos, after sporozoites, of course, mo infect og new cells to form schizones. Now, kanina part, this is now schizogony or asexual reproduction. And inside the schizones, ang ma-form kay merozoites. Okay? Now, the merozoites can either infect new cells para magpadaghan og merozoites or mahimo silang gametocytes. Mature sila into gametocytes. Both the macro and micro. So, the gametocytes now, you have macro and micro, female and male respectively, di ba? They can fuse together, pwede sila mo combine to form a zygote. And the zygote continues to mature to form the oocyst. Okay? Nagets ra, dears? Okay lang. Okay ra? Nagets ra? Wait, pinapawisan ako. Okay. Okay ra? Nagets ra, dears? Ato ang murag life cycle atong order sa mga structures. Okay ra?
Yes, sir.
How the oocysts are formed. Sige. Okay, now please take note ha. Please take note that the oocysts released by your Isospora belli are not yet mature when gikalibang siya sa patient. Okay? So, mature pa siya mga 48 hours sa stool outside the environment, sa environment, for 48 hours before siya mahimong mature and before it can infect other hosts. Alright? Okay. Ayan, sige. So, muna siya life cycle. Ayan, di ba? So, muna siya kung gi-explain. Kato kung gi-explain ng mga structures. Okay? Alright. Pero muna siya ang main na life cycle niya. Ingestion agad. No? So, very straightforward. Okay. Alright, sige. Ayan. Now, there have been reports put Isospora can be transmitted through oral anal sexual practices, like, of course, especially sa mga homosexual males. But this mode of transmission is not common and it's not well established, unlike sa mong ingestion. Okay? Alright, ayan, sige. Okay, alright, sige. Now, we go now to the structure or the oocyst, primarily morphology niya. Now, the morphology of the oocyst is iyahang shape is oval or transparent. Now, it's oval or transparent, and kung younger version siya, it contain the sporoblasts. So, pag mature niya, it can form now the sporocysts. Okay. Now, iyahang mature oocyst contains sporocysts. Sige, ako lang i-draw para mas mag-gets. Hala, wala na ink. Okay, joke. Ayan, sige. And then, inside the sporocyst, duha ka sporocysts, you have 4 ka-sausage-shaped na sporozoites. Sige. Para dili malibog, ma-confused. Okay. Okay, ayan. So this is the oocyst of your Isospora belli. Okay? So it's oval, ayan, oval, all right? And this entire thing is the oocyst. Okay? Now, inside the oocyst, you can have 2 structures. Ayan. Ay, asan na to? 2 structures. Ayan, 2 structures which are called your sporocysts. Okay? Now, inside the sporocysts are the sporozoites. Kaning mga sausage shape. Okay? Now, ang important thing is ang sporozoites. Kaya siya may mugawas. So, once inside the intestine, mo rupture ni siya. Okay? And mugawas na yung sporozoites. Okay? Alright, ayan. So, muna siya yung entire structure. Take note of the shape ha. It's oval. 2 sporocysts, 2 sporocysts, alright? And 4 sporozoites ang sulod. Okay? Please take note. Alright, wait lang. Mo charge ako dears. Okay. Alright. Okay, ayan. So, nag-gets ra? Muna yung oocyst. Okay? Alright. Asa na to? Screenshot. 54321, 54321. Charot. Okay, ayan. So, muna siya oocyst na structure sa imuhang Isospora belli. Okay? Characteristic shape, oval. Okay? Oval siya. Alright, ayan. Okay. Now, throughout its development, kani siya dears, di ay, if immature pa siya, pwede siyang mo-fuse together. Kung immature pwede siyang mo-fuse together into one structure known as your sporoblast. Okay? Pag mo-mature na siya, mo-divide siya into two, and kaning each structure now is called the sporocysts. Okay? Kung immature, pwede siyang combine together, and they are called your sporoblast. Okay? Ayan. But throughout its development na siya, double-layered wall, smooth, colorless, double-layered wall. Okay, all right, ayan. So that's for the morphology of the oocyst. So here is your illustration and the pictures, no, from samples. So again, oval in shape. All right. So as you can see in wet mounts, medyo dili siya klaro. Mo siya artifact, no. And then of course, mas klaro siya if mo siya istinog iodine. So as you can see, this is the shape oval, no. And then you have here the two sporocysts na nagdevelop pa lang. Okay. All right. So sporoblasts pa tawag ana. So kaya wala pa nakita na mga sporozoites. So it's still developing. Okay? All right. Whew. Okay, ayan, sige. So that's for the oocyst of Isospora belli. Okay. Now for disease, it's called your isosporiasis or cystoisosporiasis. Now for immunocompetent individuals, again, pwedeng asymptomatic or it may be self-limiting. So meaning it can resolve on its own mga pila ka weeks or pila ka days. Okay? All right. Now, clinical symptoms, if you become symptomatic na immunocompetent ka, you may have, you know, occasional or common symptoms sa mga gastrointestinal diseases. You have fever, diarrhea, no, weight loss, abdominal colic, etc. But ang main symptom nimo is diarrhea. Okay, so magkalibangan juga. All right. Next, for the immunosuppressed. So as you can see, for the immunosuppressed or those that are immunocompromised, no, their diarrhea could be profuse and medyo severe, no. There could be weakness, anorexia, and weight loss, and there could also be extraintestinal infections, especially among AIDS patients. So those that are really having AIDS symptoms na yun or AIDS na yun, pwede siyang mo spread ang organism to other organs. There have been reported cases of mga biliary, no, sa bile dapit, sa gallbladder na involvement, no, and other organs po. Okay, so that's for the immunosuppressed. Eosinophilia, of course, increase among eosinophils have been found also in many patients, and of course there are charcot-laden crystals because again, as we have mentioned, charcot-laden crystals are breakdown products of your eosinophils. Okay, all right, ayan. Now, this is an example of your charcot-laden crystal. Ayan, di ba? It's a crystal talaga. So this is from a stool sample. All right, ayan, sige. Okay, now it has been implicated in traveler's diarrhea, pero it's not common to cause outbreaks, unlike Cyclospora, okay, and other coccidian parasites. So it has been implicated in traveler's diarrhea, pero, again, if ang question kay traveler's diarrhea, atong main answer pa rin is si Giardia, okay? Giardia pa rin, dears, okay? But if ang question kay traveler's diarrhea in the immunocompromised or mga inana na question, then pwedeng si Isospora belli. Pero ang main answer gyapon nato ha, basta na traveler's diarrhea kay Giardia. Okay, don't forget that. All right, okay, sige. All right, so that's for the pathogenesis and the disease of your Isospora belli. Okay, all right. Now we go na to diagnosis. Of course, ang first na to procedure is of course fecal sample atong examine for oocysts. Now, wet prep, especially or concentrated material, and then ato siyang stain with iodine is the best method good for examination na kanang fecal specimens. For examination of fecal specimens, the best procedure is wet prep examination. And then we stain that with iodine, okay? Because kung permanent stain smear atong gamiton, it's not recommended because it could take up much of the stain resembling helminth eggs and or artifacts, okay? So it's best to examine it sa wet prep and then you stain it with iodine, okay? All right, ayan, sige. Now, modified acid-fast staining is still the recommended method of permanent staining for your coccidians, especially, no? Example of that is, of course, Isospora. So again, unsay difference sa modified acid-fast to your original acid-fast staining method? So may difference.
Weaker decolorizer.
Okay. Kinsa may weaker ang decolorizer?
Si modified.
Modified.
Okay, all right, very good. Modified acid-fast. So kinsa man ato ang primary stain for the two of the methods?
Carbol-fuchsin.
Okay, very good. Carbol-fuchsin. Okay, so may primary stain na to ha sa modified acid-fast and even acid-fast, of course. All right. So again, it's still the recommended staining procedure or permanent stain for your Isospora or Cystoisospora is your modified acid-fast staining. Okay. Now, it's recommended also that before you subject a stool sample to modified acid-fast staining, it's best if you concentrate, okay? You concentrate the sample and then you get the sediment, okay? Sa sediment ka mukuha og source for your permanent stain smears. Okay? Para at least, mas maklarog yun ang inyuhang parasite. Okay? All right. And of course, it's recommended that it follows pa rin at least 3 stool samples atong examine. Okay? For Isospora belli and your other coccidian parasites. Okay? All right. Ayan, sige. So here, example of your oocysts in modified acid-fast staining. Of course, again, they stain purplish, pinkish red, no, or purplish pink, yes, and this is here an example of a sporoblast, no, na wala pa siya nag-develop further. And this is also your oocyst na nanay duha ka sporocysts. Okay? So ilang appearance again, reddish, no, purplish, reddish pink, no, pinkish red. Dili gyud tong strong na red, di ba? Unlike sa mga true acid-fast organisms, your Mycobacterium tuberculosis, di ba? Ayan. So that's for the oocysts of Isospora belli in modified acid-fast staining. Okay. All right. Next, this is another appearance of your oocyst using phase contrast microscopy. So as you can see, dears, di ba, mas klaro ang inside sa imuhang sporocyst, di ba? Kani mga pataas diri, these are the sporozoites, okay? So as you can see, 2 sporocysts and you have the sporozoites sa sulod, okay? And then to right is usara siya ka sporocyst pa lang, okay? And then you have 4 ka sporozoites sa sulod. Okay? So don't be confused sa mga terms, ha? Sporocyst is the outer na container sa imuhang mga sporozoites, okay? And all together, we're high five, charot. And all together, they form your oocyst. Okay? All right. Ayan, sige. Now, another way is concentration techniques. Ayan, recall, di ba, Sheether sugar flotation method is the recommended procedure for your intestinal coccidians. So, si Isospora, Cyclospora, Cryptosporidium. And you can also use your zinc flotation techniques and even string test. Pero ang string test pa rin talaga is primarily used for Giardia. Okay? Pero we can use string test for PUD for Isospora. Okay? Alright. Ayan. Sige. Now, if sediment is nigamit kang PVA preservative for your stool, if nakag sediment from there, then that could make your examination difficult because the oocyst will become pale, loose pad, and even transparent and can be overlooked. No, pero hindi siya makita. Okay, it may be mistaken as an artifact. Okay. All right. Now, for biopsy, no, let's say for biopsy, there are cases na possible positive siya sa biopsy, meaning nakitaan siya sa intestine biopsy or sa tissue biopsy, but negative siya sa stool. So this is seen usually in cases of small numbers lang, no? Low parasitemia or low parasite count sa imong Isospora. So wala siya ni na-recover, no, sa imong stool. But sa imong intestines, nagtapot ra siya dito or dito ra siya nag-reside, then makita siya sa biopsy. Okay, all right. Now, unizoid cysts, meaning, usara, like cyst yun siya, ang oocyst niya, kay sulod, kay usa ka, example, oh my gosh, this, wait lang. Ayan, so example, ayan. So this is an example of a unizoid cyst. So this is the oocyst, and then ang sulod niya gid kay usa, no? Usa ka sporozoid, mga ana. So these are seen usually in extraintestinal infections with AIDS na mga patients. Okay? All right. Asa to kong eraser? Ayan. Okay. All right. So that's for the diagnosis of your Isospora belli, our first coccidian parasite. What you have to remember lang again is oval, no? Oval, iyahang oocyst. Infective stage is the oocyst. Oval oocyst, each containing 2 sporocysts and 2 sporocysts, each of them containing 4 sporozoites. Okay? Oval shape. Okay? Ayan. Sige. That's Isospora belli. Okay. Before we proceed to Cyclospora, yes, do you have any questions, dears? Okay. Any questions? Any clarifications? Okay na so far? Nandiyan pa ba kayo? Gising pa ba?
Sir.
Okay. All right. Sige. So that's for our first coccidian parasite. Your Isospora, Cystoisospora belli. Okay. All right. Next, we go to the second coccidian parasite, your Cyclospora. So your Cyclospora cayetanensis was first thought to be a cyanobacteria. All right. So bacteria na nasa environment that produces or that undergoes, no, photosynthesis. Okay. Because it was discovered to have photosynthesizing organelles. Okay? So, sabi nila, maka-photosynthesize siya, no? And aside from that, it also exhibits autofluorescence. Nako, yes, very important. Lumabas sa pretest, di ba? So, autofluorescence, it's capable of autofluorescing, which is typical sa mga algae, no? Sa mga algae sa environment. So, they thought na appeal po si Cyclospora dito. But then, further studies found out that it was a coccidian parasite. Ayan, sige. Now, your Cyclospora, again, these organisms could be acid-fast variable pag yun. So, their staining with the modified acid fast is not consistent, no? Para sa mga ex niyo, charot. So, dili sila consistent, no? It's not always na ma-stain gyud sila. Night times na dili sila ma-stain, night times ma-stain pod. So, acid fast variable. And it can also be recovered from a lot of patients, not only immunocompromised, but also mga immunocompetent individuals, especially those that have traveled, no, to endemic areas for this parasite. So, usually, Cyclospora endemic siya sa mga Central America or South America na areas. Okay? All right. Ayan. Now, man serves as the only host food, no? So, same siya with, in a way, same siya with your Isospora. Pero there have been reports or studies na ang Cyclospora can also have other hosts, all right? But for now, ang mention, I think di ka ni sa Belisario or sa Garcia, man serves as the only host. Okay? Ayan. All right. Sige, that's for Cyclospora. Okay. Now, for infective stage, it's still the same. Your spore-related oocyst, no? Mature oocyst. Mode of transmission, same with your eye belly or Cystoisospora belly, ingestion pa rin of contaminated food or water that has the cysts. Okay, all right. Now, outbreaks, ayan, very important, because this organism has been linked, no? Or there have been reports, cases of outbreaks caused by Cyclospora. And as a gikan, water, okay, common ang water, pero mas common ang mga fresh produce. Ayan, fresh produce, especially ka na naka-red dyan, raspberries. Nako, ayan. Basta mga mga raspberries, no, mga raspberries, kana dyan ha, raspberries, nasa case study or whatever, like the patient has a history of ingesting raspberries, tapos nagkalibanga siya, nako-press the buzzer, wag nang mang-isip, it's Cyclospora, cayetanensis. Okay? So aside from Cyclospora, you have also basil, baby lettuce leaves, and even snow peas, no? But ang pinaka-common yun, mga raspberries. So kanina sila manggod na mga food, di ba? Usually, they are consumed, no? They are eaten raw, di ba? Di man na siya lutuon, di ba? Example, raspberries, ato mga desserts, di ba? Usually, kung na raspberries, it's raw, no? Mga basil, baby lettuce leaves, snow peas, in mga salads, no? Mga salads, usually, they are raw, no? So, let's say, it's improperly washed. Ayan. Improperly washed, yung mga produce, kani sila, it contains the oocyst of your Cyclospora packed, di ba? It's very conducive for infection. Ayan. So, raspberries, if tiglanta mo monsters inside me, and if you want to watch, na mga, this is a show sa Discovery na real-life yun, mga real-life parasitic, fungal, I'm not sure if na bacteria, pero mag-parasitic, fungal na mga agents, mga diseases. One of the episodes there, ang ilang i-focus sa segment, kay mag one episode to look at parasite diseases, no? So, ang first one segment dito, kay nag-focus sila og Cyclospora. And asa nakuha sa mga patients sa raspberry. So, it was a group of doctors na nag-attend of convention, no? And then, sa convention, ang ilang dessert, kay mara siya pudding, or basta cream something, mara siya, di siya smoothie, basta cream something, cream-based na murag dessert, and it contains raspberries. Ayan. And then, pagkawan sa convention, after pila ka days, after pila ka weeks, kato mga ni-attend dito na kakaon, nag-exhibit nag-intestinal symptoms. And then ilang gi-discover, ilang gi-examine sa ilang mga tropical medicine doctors there, infectious disease experts. It was found out na the outbreak was caused by Cyclospora. Ayan, di ba? So, it's happening in real life, dears. It really happens in real life. So, ayan, Cyclospora cayetanensis. Basta mga raspberries ha, raspberries nako. That's Cyclospora cayetanensis. Okay? All right. So, may mga outbreaks that has been linked, no, to your Cyclospora. Okay. All right. Now, life cycle, similar Japan with your eye belly, katong oocyst, ma-ingest na to, mugawas ang sporozoites. The sporozoites then infect new cells in the intestine to produce schizons, no? And then schizons produce metazoites. Metazoites will then infect other cells or become gametocytes. The gametocytes will then fuse macro and micro to form your oocysts, which will now serve as the infective stage. And mubalik na Japan ang life cycle. Ganun. And the site of predilection, or kung asa siya ganahan, or kung asa siya daghan, is the jejunum, sa small intestine pa rin. Okay? Alright, ayan. Now, morphology, please take note, ang oocyst this time is round. Ayan. So, different na siya with eye belly. So, round ihang shape, and this time it contains, ang pangit talaga ng drawing ko. You have a round na oocyst, and inside the oocyst contains duha ka sporocysts. And inside the sporocysts are two small na sporozoites. Ayan. So, inani siya. Diba? Mara siya, ano, no? Mara siya nose sa pig. Charot. Ayan. So, again, this is the oocyst, diba? The whole thing is the oocyst. The smaller circles, again, are the two sporocysts. And inside the smaller circles or inside the sporocysts are the two sporozoites. Okay? Please take note. Now, in any appearance, okay, that's why we have two identify it correctly because it can also mimic, or it has the same appearance with Cryptosporidium. Okay, the difference lang is your Cyclospora is larger. Okay, it's twice the size of Cryptosporidium oocysts. So please take note mga measurements dyan. Wala na ako nabutang sa inyong notes, so take note lang. Okay, so same sila appearance sa inyong oocyst sa Cryptosporidium, the difference lang is sa size. Okay, the size is larger, no? Twice larger ang imuhang Cyclospora na oocysts. Okay? Alright, ayan. So that's for the structure, morphology of your oocysts. Okay, alright. Sige. Now, this is your life cycle. Ayan, as you can see, di ba? So, same siya with your Isospora belli, the ideas, na pagpagawa sa environment, it's unsporulated. Meaning, dili pa siya infective dayon, dili siya mature. So, it will take, again, days or hours before siya mahimong mature. Okay? So, same siya with Isospora belli. Okay, so again, so the same, pwede siyang ma-appeal sa imong mga fresh produce. You have cilantro, basil, raspberries. Pero siya pang master chef, no? Yes naman. Kaya siya ng mga words kay pang master chef. Yes naman. Ganon. Okay. And then, of course, ma-appeal siya ani ng mga fresh produce and that may contain the oocyst, makaon sa patient, and then the cycle goes on. Okay? Alright. But again, take note ha, same with Isospora belli. The oocyst, once outside the environment or once passed in the stool, it's not yet infective. It's not yet mature. Okay? Alright. Please take note of that. Next, we go now to the disease. Joke, pictures pa. So this is the picture, no? Or this is the oocyst in wet mouth. So as you can see, perfect circle gid siya, no? Medyo thick iyahang wall, no? Defined gid iyahang wall. And then the inside are the developing sporozoites and sporocysts. Okay? Same here is again your phase contrast microscopy, no? So you have again the two sporocysts and the inside are the developing sporozoites. Okay? All right. Ayan. Sige. Now we go now to the disease. Again, cyclosporiasis. Incubation period is about 2 to 11 days after exposure. So after yung makakaon o raspberries na ay cyclospora, so after 2 to 11 days, mugawas ang symptoms. Then there's generally 1 day of malaise, so maglain mong paminaw, no, sakit mong lawas, and then low-grade fever, medyo dili lang taas na temperature na fever, and diarrhea, up to 7 stools, no? 7 stools per day. Kapuya na, wait. All right, okay. There may also be fatigue, anorexia, vomiting, and myalgia. And there could be a remission. Mubalik siya. Pero self-limiting ragyapon for 3 to 4 days na diarrhea. Okay, all right. Now for the immunocompromised, okay. Saan galing yun, Mark? Immunocompromised patients, especially with AIDS, no, there may also, again, extraintestinal infections that may happen, especially sa biliary duct pa rin, no, biliary disease, sa mga gallbladder. Okay, all right. There could be malabsorption of your D silos, no, in some patients, and clinical presentation, again, similar siya with Cryptosporidium. So the disease, cyclosporiasis and cryptosporidiosis are quite the same in terms of mga symptoms nila. So you have to differentiate the oocysts that you may find, no? So in order for us to differentiate that, we need to measure. We need to measure the oocyst using micrometry. But again, as mentioned, diba, micrometry is not routinely performed in the Philippines. So usually sa ibang countries or mga reference labs, no? So we then go to other mga tests, pwede mga antigen detection or other mga tests. Okay? All right. And also take note that longer ang diarrhea sa imong Cyclospora compared sa imong Cryptosporidium. Okay? All right. Ayan. Now, infections, again, are usually self-limiting, especially, again, if you're immunocompetent, no? Okay, yung immune system, it's functioning well, then, of course, self-limiting lang ang infection. But in immunocompromised patients, again, with AIDS, no? Patients with AIDS, then symptoms may progress to extraintestinal infections and become severe. Okay? All right. Ayan. Sige. Now, for diagnosis, of course, microscopic examination pa rin of your fecal smears under HPO, high-power examination. In clean, wet mounts, it may appear as non-refractile spheres. Mas mga empty circles, okay? Empty circles na medyo hayag-hayag, okay? So, ato na siya malantaw later sa picture, no? So, in clean, wet mounts, no? So, it could be non-refractile spheres that can be mistaken as artifacts. So, pwede siyang ma-overlook, alright? For staining, still the same, modified acid-fast stain ang recommended. Again, as mentioned, it's best that you concentrate muna the sample and you get the sediment for staining, okay? All right. Now, modified acid-fast, again, acid-fast variable sila, dili consistent ang staining nila. It could be na uba na dili ma-stain, uba na ma-stain, okay? Acid-fast variable. And those unstained, wala ni take up sa primary stain, it could appear as wrinkled spheres or iyang description kay wrinkled cellophane. So, same siya appearance anang kanang na-wrinkled na cellophane sa offertory. POV, kanang offertory ka sa misa, charot. Sulod kag cellophane. Ayan. So, and ato na appearance, no? White, clear cellophane na wrinkled. And ato yung appearance. If dili siya ma-stain. Okay? Ang imong Cyclospora. Alright. Now, when stained, oocyst, again, light pink to deep red, and some will contain granules, alright? And it will have a bubbly appearance. Wow, bubbly ka, girl. Ayan, so lively ni siya, charot. Bubbly by Colby Calais, ganun. Okay, ayan. And another technique that we can use is modified safranine technique. And using modified safranine technique, ang color niya is about orange or pinkish orange. If you heat the smear using microwave, okay, during staining, if you heat your smears during staining, the color or your oocyst will appear brilliant reddish orange. So, pwede siyang brilliant reddish orange. Okay. Another thing is you could also use this reagent to visualize your oocyst, your 5% potassium dichromate. Okay? Please take note. Take note. 5% potassium dichromate. You can use this for Cyclospora to visualize more your oocysts. Okay? All right. Ayan. So that's for Cyclospora cayetanensis. Okay. Now, these are your pictures, of course, of your Cyclospora. Stained sa left is stained by modified acid fast. As you can see, usa lang na stain. The rest, kaning tulo, 1, 2, 3, wala siya na stain. So, yan siya, acid fast variable. Not all of them can retain the primary stain, which is your acid fast, your carbofluorescence. Ayan. And here is the appearance of the unstained. As you can see, diba, wrinkled, no? And ang appearance kay siya wrinkled cellophane. Okay, so wrinkled cellophane. Okay, wrinkled sphere, wrinkled cellophane. Okay, all right. Next, very important procedure din, dear Presto Buzzer, autofluorescence. Now, this organism exhibits autofluorescence. Diba? If you can remember yung pre-test, nigawas ni siya, this organism exhibits autofluorescence. Wala nang iba si Cyclospora cayetanensis. So we then subject that to UV, no? UV light or UV microscope, no? And then mo exhibit siya autofluorescence depending on the filter na imong gigamit. So if 450 to 490 kay strong green, if 365 kay intense blue. Okay? So when you say autofluorescence, siya mismo, imo ra siyang i-expose og UV, ano siya fluorescence na ma-produce, okay? Dili siya, you don't need to add fluorochromes, no? Like mga FITC, TRITC, di na ka mag-add. Or mag-add ba kag mga antibody labeled na fluorochromes? No, you don't do that because the organism in itself, pag expose mo siya dahil ng UV, mo fluoresce na siya. Okay? Alright, mag-fluoresce de Mayo. So, pila ko mahitabo niyang autofluorescence every May kay fluoresce de Mayo. Huy, oh my gosh, funny ba ito? Alright, sige. So, fluoresce. Hala, oh my gosh, Mark. So, autofluorescence. Now, very important. I-add yun yung characteristic. Autofluorescence, okay? DM, dira, dears, dili na siya direct message para sa mga kabiga sa Twitter and IG. Charot. DM there means dichroic mirror. So, hindi siya ginagamit na filter, no? DM, dichroic mirror. Okay? Dichroic mirror. Okay. So, this is used sa filter. Okay? Dili na siya katong imong mga kabiga sa IG o sa Twitter. Charot. Ayan. So, autofluorescence hack. Minsan ganyan mo exhibit og autofluorescence. Si Cyclospora cayetanensis. Nako talaga. Lumabas sa boards din, no? Ang question kay this organism exhibits autofluorescence. Wala nang iba, your Cyclospora cayetanensis. Okay. Alright. Now, concentration techniques using FECT or Sheether Sugar Japon, 10 minutes at 500 times G. So, slow speed lang, 500 times G. Okay. All right. Again, to prevent, no? To prevent the destruction of your organisms. Okay? So, don't forget, ha? Autofluorescence, fluoresce de Mayo. I-push nyo na ako. sorry. Mabawra ko kalipay. Okay, anyway. Last is your flow cytometry. Ayan. Ako, flow cytometry, jar. Na-remember pa ba itong HEMA, automation, and IS din, no? So, flow cytometry, Cyclospora, ginagamit siya for large samples, especially for large samples in mga outbreaks. Okay? Kaya pwede na siyang ipaagir ang sample sa flow cytometry and then ma-identify na ang mga Cyclospora. Diba? So, flow cytometry, diba? Atong i-focus sa flow cytometry. Diba? We have your forward and side scatter, no? So, ang forward scatter, unsa gani gina-detect sa forward scatter? Yes? Nandiyan pa ba kayo or na-disconnect ko? Teka lang. Na-disconnect ko? Okay. Unsa may na-detect sa imuhang forward scatter?
Cell size, sir.
Okay, cell size ba? Tama ba? Do you agree? Halhiluma, oy. What's naman? What's happening? What's naman? Forward scatter. What's naman yung na-detect sa forward scatter? Yes? What's naman? Forward scatter. What's naman na-detect sa forward scatter? Mag-agree mo sa answer ni Ron na cell size? Hello, Ma'am Mir. Sa maning atong students. Wala sila naka-remember sa flow cytometry. Charot. Ano man? Ano sa matong for forward scatter? Cell size? Tama?
Yes, sir.
Okay. Alright. Wala na mo contest ato, wala na mo against sa answer ni Ron o ni Linsley. Tama na yon. Ang cell size ba kay forward scatter? Cell size ba ma-detect sa imong forward scatter?
Opo, sir.
So let's say board exam na karon. Yan mo na siya question number 94. Okay. Ano sa man yung answer? Forward scatter detects A, cell size. B, blah, blah, blah. Ano sa man natong answer?
A, sir.
A. So, Linz, ikaw rin mo boards? Joke. How about the others? Ano sa man natong answer? Ano sa man to, Mer? Ano sa man?
A na lang, sir. Wala mo yun.
Wala. Ano sa naman? I feel like na-discuss na sa hima, baka nalimtan lang. So, your forward scatter is, mo detect og, or it detects your cell size. Tama. I'm just asking if tama ba ang atong answer. Cell size. Very good. Tama. Cell size. Corresponds to cell size. Your side scatter, however, unsa may i-detect sa imong side scatter?
Inclusions.
Ha? Unsa Ron?
Ang inside sa cells are like
Ang inside sa cell. Okay. What about inside the cell? Unsa atong gina-look into?
granules.
Okay. Granules. Tama ba? Okay. How about the others? Do you agree? Granules ba daw ang ginalantaw inside the cells sa side scatter?
Granules and nucleus, sir.
Granules sa nucleus. Granularity, sabi ni Darlene. Tama ba? Do you agree? Granularity ba? Okay. Final answer? Let's say muna siya number 95 sa boards. Nagsunod sila. So, ito yung answer, Ana. Kung ang side scatter, kung ang forward scatter kay cell size, ang side scatter kay cell,
Granularity.
Okay, very good. That is correct. Cell granularity or complexity. Okay? Ayan, sige, ako na lang i-discuss. No? So, here is an example of your, sige, kana. So, this is an example of your cell under na siya sa flow cytometry. Now, your flow cytometry, again, if maka-remember pa, daghan siyang components. Okay? Daghang components mong flow cytometry. Okay? Alright. Now, for flow cytometry, as you can see, kaning tunga is the cell. Okay? Natay light source, okay, light source, na mo igo sa cell. Okay? Now, your forward scatter, as you can see, ang light, pag igo sa light sa cell, mo scatter siya, di ba? Of course, mo scatter siya. Now, ang forward scatter mo detect sa size. Kaya, di ba, imagine, lisod ko ba yun? Imagine, if dako ang cell, so ang light na yung mas-scatter kay dako pod. Diba? And muna siya ma-detect sa forward scatter. So, it detects size. Kaya if gamay ang cell, example, if inanara ang cell, let's say, if gamay ang cell, example, inanara ang cell. So, therefore, ang light niya is, dira rakutob. Gets? Padulong sa forward scatter. That's why iya ka ma-detect kay size. Gets? Now, kung side scatter, okay, so it detects the internal complexity of your cells or granularity. So, meaning, the light that is reflected after maigo sa light ang inside sa cell. Okay? So, pag bounce back sa light, of course, if mas complex siya, okay, or if mas daghang granules, then in a way, medyo ubay-ubay po na light iyang mabalik, which is, muni ang side scatter na iyang ma-detect. Okay? Which is ang side scatter ang mo-detect, ana. Okay? So, forward scatter, size, okay? Di ba? Mo-matter siya if dako ang cell or if gamay ang cell, di ba? Okay? And side scatter, no? Side scatter after siya musulod or after niya maigo ang sulod, no? Mo-reflect siya og light sa kilid. Okay? And the more light ang makuha or ma-detect sa imong side scatter, meaning mas daghang granules mas complex ang sulod sa cell. Okay? Gets? Kira? Gets ra? Nag-gets ra?
Yes, sir.
Okay, alright, sige. O, review tayo sa HIMA dyan, okay? Muna yung didactics next sem. HIMA ISBB, nako, laban lang. Okay, alright. So, that's for flow cytometry, ha? Don't forget. Okay, alright, sige. So, we'll continue. So, flow cytometry, again, can be used for detection of Cyclospora. Okay, alright, sige. Next. Okay, alright. Now, this is an example of your autofluorescence, yung Cyclospora. Again, yung autofluorescence, as you can see, it could be intense blue or strong na green, depending on the light filter, the dichroic mirror na imong gigamit. Okay? Alright. So that's for Cyclospora. Ayan. So before we proceed to the last organism for today, do you have any questions, dears? Sa Cyclospora and Isospora? Any question? Any questions? Again, don't forget what we have to remember about Cyclospora. Raspberries, nakot important, raspberries talaga, raspberries. You have also autofluorescence, kana gud silang duha, no? Mga distinct characteristics ni Cyclospora. You have raspberries, pwede makuha from eating raw na raspberries na wala gi tarong og hugas, yes? And autofluorescence. Please take note, autofluorescence. Nako, press the buzzer na gyud. Okay. All right, before we proceed to the last organism for today, any questions, dears? Any clarifications? Okay. Again, side scatter. Sa itong i-detect sa side scatter? Sa flow cytometry?
Granularity.
Okay. Your cell granularity. Okay. And for forward scatter, ang forward, ano man?
Cell size.
Okay. Alright. Don't forget atong drawing, ha? Dito ko mas nakasabot pa ato na drawing. Okay? Alright. Ayan. Sige. Now, we're going to the last organism for today, and that is your Cryptosporidium. Okay. Now, for Cryptosporidium, for the longest years or for the longest time, it was accepted that it's only Cryptosporidium parvum that affects man and other mammals. But further studies found out that other species that really affect man or humans, and that is your Cryptosporidium hominis. So si C. hominis and C. parvum atong important species sa Cryptosporidium. Okay, daghan pang other species that infect other animals pod, pero ang nag-infect ra sa man is parvum and hominis. Okay, and if you want to differentiate the two, you cannot do it if oocyst imo basihan because they look the same. So you perform mga PCR molecular methods. Okay, all right. Now, again, for Cryptosporidium, among the three na itong na-discuss, siya yun ang pinaka-important. Actually, siya yun ang pinaka-important because it's one of the more important, one of the more pressing na mga opportunistic infections among the immunocompromised, especially sa mga AIDS na patients. And usually, if the AIDS patient has this disease or ma-detect ang Cryptosporidium in the AIDS patient, it could indicate poor prognosis. All right? So it could lead to death yun. So same gyapon sa Monsters Inside Me. If nakalantaw ko na usa ka episode dito pod na ang cause sa outbreaks gyapon is Cryptosporidium. Okay? And ang first na na-infect kay usa ka AIDS na patient. And sadly, the patient died. So hinana siya ka-intense sa mga immunocompromised, ang imong cryptosporidiosis or Cryptosporidium. So siya ang important yun. Siya ang pinaka-star ng Pasko, yes na level sa tulo natong na-discuss, ang Cryptosporidium. Okay. Alright. Now for hosts, again, man and pwedeng other vertebrates. Okay? For C. parvum, very important. Ang important na host ni C. parvum kay cattles, no? Mga cows, no? Cattles. Ayan. For C. parvum. Okay. Now, reservoir, again, as mentioned, pwedeng man, pwedeng cattle, mga cows, cats, and pwede pong dogs. Okay. Now, infective stage, still the same with the rest, with the two natong na-mention, sporulated oocyst. And for the modes of transmission, ayan, pwede siyang marami. No? So, ang primary gapon is ingestion of food and or water contaminated with the oocysts. But it can also cause auto-infection. So later we'll know anong pwede siyang mag-auto-infection. It could also cause direct person-to-person transmission, sexual practices, and even contamination or exposure to positive specimens. So inana siya ka infectious food. Okay? Alright, ayan. So later we'll discuss nganong possible tong ato mga roots na yun ato. Okay. Now, life cycle, same ragapon siya actually with your Isospora and Cystoisospora, Isospora and Cyclospora. Musugod siya again as oocyst. Oocyst insists in the small intestine. Again, release sporozoids. Sporozoids infect cells and produce merozoites. Merozoites, again, infect other cells or become gametocytes. The gametocytes produced can fuse, okay, can fuse into two. and again, make the zygote and form the oocyst. But this time, ang Cryptosporidium, pwede siyang mo-form og parasitophorus vacuole. This parasitophorus vacuole is a cell membrane or para siyang cell membrane kung asa mo develop ang imuhang sporozoites. Okay, sa layers, sa epithelial cells makita. Okay, so parasitophorus vacuole. So these are layers of ER, no, endoplasmic reticulum. Sorry, ER. Sorry, dears. So layers of endoplasmic reticulum, no, that again serves as parang a habitat or parang a home, no, for your oocyst to develop. Okay? Ayan. Sige, that's for Cryptosporidium na life cycle. Again, same nagyapon siya with Isospora and Cystoisospora. But what you have to remember lang, dears, what you have to remember lang yun is ang imuhang oocysts, pagpagawas sa environment, sa stool, it's already infective. So pagpagawas dayon, pwede na siya mo-infect agad-agad. That's why pwede ang imuhang person-to-person transmission. Because, again, di ba, pagpagawas pa lang daan, paglibang sa patient, if na oocyst sa Cryptosporidium, pwede na siyang maka-infect of another host. Unlike sa imong Isospora and Cyclospora, mutik magpila ka days, di ba, before mahimong infective imuhang oocysts. For Cryptosporidium, immediately after passing in the stool sa environment, infective na siya. So pwede ang direct person-to-person, like fecal-oral, no, contaminated hands, mabutang nimo siya sa mouth nimo ba or sa other patient, as other hosts, etc. And also pwede po siya contamination or ma-expose ka og specimen, example as medtex, di ba? Na maka-touch ka og stool sample kuno na oocyst of the Cryptosporidium and then wala ka naghinaw or whatever, so inana. So muna siyang possible ang person-to-person or direct transmission. Because again, the oocysts are already infective when passed in the stool. Okay? All right. Now take note again, C. parvum, important major hosts are your cattle, your cows, di ba? So, basta mga C. parvum, press the buzzer, ato ma-relate dayon kay ang mga cows, mga cattle. Okay, mga baka, ganun. Okay, all right. Now, we go now to your morphology. Your oocysts, again, is round. So, same siya appearance or same siya shape with your Cyclospora. Now, another important difference is that ang imuhang oocysts, wala na siya sporocysts. So, pagsulod sa oocyst pa lang, diretso ng mga sporozoites. Okay? So, this is the oocyst of your Cryptosporidium. Ang sulod dayon is the sporozoites. Okay? Wala na katong sporocyst, parehas ni Cyclospora and Isospora. Okay? So, ang imuhang oocyst sa Cryptosporidium, cyst, okay? Oocyst, ang sulod kay sporozoites na agad-agad. Okay? So, 4 small sporozoites. Again, they do not contain sporocyst. And there could also be granules na pwedeng makita. Okay. All right. Now, this is your illustration. Ayan, di ba? As you can see, diretso na. Wala na yung sporocysts. So, diretso na mga sporozoites. Okay? So, you have here the picture, di ba? Kani mga nasa sulod na nag-develop or yung mga structures na makita sa sulod, this now are your sporozoites. So, wala siya sporocysts. Okay? Wala siya sporocysts. Pareha sa imuhang Isospora and Cyclospora. Okay. All right. Now, your oocysts can also be in 2 forms. Pwedeng thin-shelled or pwede po siyang thick-shelled. Now, your thin-shelled comprises mga 20% of the oocysts produced in an infection. No? So, if ma-infect ka Cryptosporidium, 20% sa oocysts na ma-produce kay thin-shelled. Now, this thin-shelled oocysts are the ones responsible for auto-infection because thin-shelled siya. So, dali na siyang ma-rupture. Dali na siyang mabuslot. No? So, pwede na siyang magpa-stay, pwede na siyang stay sa imong intestine and then mag-insist siya sa small intestine and then rupture dayon and cause infection. So, that's because of thin-shelled oocysts. Okay? So, siya ang cause sa auto-infections. This is the reason why also, kato mga immunocompromised, even if wala na siya contact o ingest infected water or contaminated food or water, magpadayon siya po niyang symptoms because of auto-infection, okay, sa thin-shelled oocysts. But majority, 80% are thick-shelled. And these thick-shelled, because they are thick, no, ilahang outer covering kay thick, they can resist the environment. So sila ang ma-excrete sa environment and maka-resist ng mga chlorination, disinfectants, no. That's why pwede siya ma-transmit to another host. Okay? So thick and thin. Yes naman. Thick and thin-shelled oocysts. So ang thin-shelled ang responsible for auto-infection, thick-shelled ang responsible for sa environment to infect a new host. Okay? All right. Ayan. Now, as mentioned, it's immediately infective when passed in the stool. So, pagpagawas dayon, it's infective. Okay? Alright. Shucks. Okay pa ko, dears? Nara kong connection. Madungan pa ko ninyo. Kaya nag-ulan. Okay ra?
Yes, sir.
Kasi ma-disconnect ko. Sige, sige. Okay. Alright. Now, please take note, kinsa itong mga organisms na makakos og nursery school, mga outbreaks sa nursery schools sa mga bata. You have G. lamblia, D. fragilis, and Cryptosporidium. But for waterborne outbreaks, good, ang pinaka-important or pinaka-common na parasites na makakause og waterborne outbreaks is your G. lamblia and Cryptosporidium, di ba? As mentioned po, if maka-remember mo sa atong lecture sa flagellates with Giardia, di ba nato yung one test kit dito na na Giardia and Cryptosporidium. Because again, di ba, usually they cause mga outbreaks together. Well, not be together, pero silang pinaka-common good na makakause. Okay? Sa mga parasites, waterborne outbreaks. Okay, all right. Now, for immunocompetent individuals, if ma-infect ang Cryptosporidium, you may exhibit symptoms. You have nausea, low-grade fever, cramps, and 5 to 10 watery or frothy bowel movements. And then followed by constipation. So, pwedeng intermittent imuhang pagkalibanga, no? So, pwedeng today mag-diarrhea ka, pagkaugma constipation na po, then pagka-following day, diarrhea, etc. So, intermittent siya. Okay, all right. Next, again, in patients na nag-exhibit og symptoms, ang ilahang attach or ilahang stool contains a lot of mucus. Little fecal material but contains a lot of mucus, no? Watery and naay mga mucus, and the organisms are expected to be entrapped, no? Na-trap siya sa mucus. So when we examine the sample, we have to get samples from the mucoidal part, katunay mucus. Okay, all right. Ayan. Now, generally, again, as mentioned, what we have already mentioned sa mga previous na previous na organisms, basta normal ang immune system, self-limiting na ang infection. It can resolve within mga pila ka days. Okay. All right. Ayan. Now, in general, of course, when CD4 plus T cells are high, greater than 200 per UL, then, again, self-limiting ang infection. It can resolve within 2 weeks. Okay. All right. Now, for immunocompromised, of course, mas intense ang atuhang symptoms. As you can see, pwede siyang spread outside of the intestines, no? Additional symptoms, pwedeng maabot siya sa lungs, respiratory, cryptosporidiosis, pwede siyang sa cholecystitis, sa imuhang gallbladder, liver, hepatitis, and pancreas. Okay, all right. Now, diarrhea, again, mas severe, it's life-threatening and progressive. Magsigig pa dayon, sana all. Okay, and it can also cause sclerosing cholangitis. So when you say sclerosing cholangitis, your bile duct, no? Your bile duct is always inflamed, and because of that, it causes scarring. Mag-produce yung mga scars, no? Muna siyang sclerosing cholangitis. Okay? So, biliary involvement, cryptosporidiosis, and also usually seen in AIDS ng mga patients. Okay? Sclerosing cholangitis. Okay. All right. Now, villi of your intestines could be blunted sa imong small intestine. Example kanino. As you can see, medyo na-distort, no? Na-disfigure iyahang shape, iyahang appearance. So, blunt, no? Medyo dili na siya smooth, but dili siya sharp or pointed. Medyo siya, blunt. Okay? Ayan, alright. Which, again, would affect your absorption and could lead to malabsorption and fluid loss. Okay. Now, hemodialysis patients, mga immunosuppressed, no? Renal transplant patients, if maka-cryptosporidiosis siya, then they can also progress to life-threatening diarrhea. Okay. And of course, HIV, no? Ka-remember pa mo, HIV serology ninyo sa IS, no? What we're looking after, again, is the CD4 T cell count, diba? That's one of the things that we monitor in patients with HIV, the CD4 T cell count. And we want to make sure that the CD4 T cell count is higher, greater than 200 cells per UL. Because less than 200 cells per UL, then the patient is prone to mga AIDS-related diseases, mga opportunistic infections. Okay? So, dapat taas, di ba? Greater than 200 cells per UL. So, remember pa yung IS, HIV serology, CD4 T cell count. Okay? So, the CD4 T cell count, again, is one of the things that we monitor in patients with HIV. Especially if the patient is already taking drugs, no? Your HAARTs. So, when you say HAARTs, your highly active antiretroviral therapy. Okay? So, antiretroviral therapy. Your HAARTs. Okay? HAARTs. Okay. Highly active antiretroviral therapy sa ato mga HIV patients. Okay? HIV patients. HAARTs. Okay? So once a patient is taking HAARTs, one of the things that we monitor is the CD4 T cell count. Because we want to make sure na taas ra gyud sige yang CD4 T cell count. Greater than 200 cells per UL. Because that will prevent the patient from developing mga AIDS related na mga complications. Okay? Katong mga opportunistic infections, especially, apil na ani si cryptosporidiosis. Okay? Alright, ayan. So if ang patient nagtambal na, gamay gyapon niyang CD4 T cell count, then that could indicate na the patient is not responsive to treatment. Okay? Alright, so don't forget that ha. Less than 200 cells per UL, again, prone na to AIDS, or patient can be diagnosed with AIDS na. But greater than 200 cells, T cells ha, CD4 T cells per UL, then patient can still fight off mga opportunistic infections. Okay. Kinsa ba rin yung mga CD4 T cells? Kinsa ba rin siya na type of T cells? Yes?
Helper, sir.
Grabe, ang intense ng background. Kinsa na yung CD4 T cells? Kinsa ni sila na type?
Helper. Charot.
Your T helper. Very good. T helper. Okay, helper T helper cells. Okay. All right. And atong kinsa ba tong cytotoxic din nato?
CD8.
CD8.
Very good. CD4, CD8. Now remember, unsa ba tong normal ratio nato CD8 to CD4 ratio? Ka remember pa? CD8 CD4 ratio sa IS ninyo? Na remember pa ang normal CD8 CD4 ratio para ma-prevent ang HIV or in a normal immunocompetent patient unsa may normal na CD8 CD4 ratio?
Greater than 1?
Ha?
Greater than
Unsa?
1?
Greater than 1? Ratio man siya, ratio.
Oh, okay.
Na-remember pa? Yun sa man. Normal CD8, CD4 ratio is?
2:1.
Okay. So, mas daghan dapat ang, actually, if inani siya, CD8, CD4, mas daghan dapat ang CD4. So, 1:2. Okay? Alright. Pero kung CD4, CD8, 2:1. Okay? So, dapat mas daghan ang CD4. Okay? Pero, if AIDS patient, so of course, mubali ni siya. Mas mudagan ang CD8 kaysa CD4. And that will lead to, ay, ba yan? Klaro. Okay. So, kanina siya baliktad, 2:1 na CD8, CD4 ratio. That is, na something problem, na something wrong na dira. Because gamay na mo CD4. Okay? Pero in normal normal, kung CD4, CD8, atong ratio is 2:1. Please take note. Mas dako ang CD4 kaysa CD8. Okay? Alright. Ayan. Sige. So, that's for your pathogenesis. Now, for diagnosis, of course, stool examination pa rin. In diarrheic na mga stools, the best specimen or best consistency is diarrheic. Because the more diarrheic the stool is, the more oocysts that can be recovered. Because if formed ay mohang stool or katurang mga hard, normal na mga stools, daghang artifacts na pwede naa. Okay? So, the more diarrheic, the more oocysts ang naa. Okay, alright. Now, concentration techniques can also be used, your Sheether, sugar, or FECT, no? And of course, staining modified acid-fast stain. So in the picture, ayan, as you can see, red-pink, donut-shaped, marshag donut, okay, circular organism. So as you can see, kani deers, kani mga individual na ano diri, these are the sporozoids, okay? Recall, di ba, that ilang oocysts, wala na siya sporocyst. Diretso ng sporozoids. And modified acid-fast is the cheapest and quickest method of diagnosis. Okay, all right. And at least 5 or 6 pa rin ang kailangan nato na acid-fast smears. For the specimen, with the rest of your coccidian, Isospora, Cyclospora, Cryptosporidium, we need at least 3, okay? 3 stool samples, the usual na to na protocol, okay? 3 stool samples before we report a negative result. Okay, now antigen detection, di ba, as mentioned, immunoassays, usually with Georgia, they are more sensitive. Mga immunochromatographic kits, enzyme immunoassays, antibody detection, not available on a routine basis and not used in diagnosis. Histology, as you can see, jejunum gyapon siya makita daghan kaayo, and routine H&E staining, your organisms can be seen on the surface along the brush border of your intestines. So for pictures na lang, so here is an example of your immunoassay kit, di ba? Immunochromatographic kit, expect contains Giardia and Crypto na already, so 2 birds with 1 stone, 2 organisms in 1 test kit. Okay, and this is biopsy in the intestine. As you can see, this is the brush border in yung histology, no? Sa intestines, your brush border kaysa surface, which contains the mga villi. So your organisms will be found there at the top. Okay, they will be aligned along the brush border. Okay, so as you can see, the organisms wala gyud siya ni penetrate deeper into the cells, no, of your intestines. Nara siya sa surface. Okay, all right. So along the brush border sa mga histological preparations. Okay, all right. Ayan. Now remaining molecular methods, of course, to differentiate the species, which is best na procedure. Sputum in cases of respiratory cryptosporidiosis, it must be submitted in formalin, 10% para ma-preserve. And of course, for any samples, stool and body fluids, it can be submitted as fresh or preserved in formalin or using the single vial collection systems. Fixed specimens pa na ito recommended because of pwede tang ma-expose, di ba? Sa imuhang stool, no? And the stool can serve as a source of infection for us na mo examine. And di ba, infective na daan ng oocyst. So if makakontaminate sa stool or sa stool na positive for Cryptosporidium, pwedeng makuha nato ang oocyst. Okay? So preserved or fixed specimens ang recommended. Okay? Alright, ayan. And that's the end for today. Medyo na-extend tayo ng oras, pero wala naman tanabot og 5, so okay ra. So that's all for today, dears. Yes, before we end, do you have any questions? Any clarifications? Okay. Alright. Sige. So ako sa stop ang recording ha. Teka lang. So again, before we leave, don't forget tomorrow,